This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Richar Cr Injection is a vital treatment for managing iron deficiency anemia. It is specifically designed to restore iron levels in the body, promoting better health. Indications and uses. This injection is primarily indicated for the management of iron deficiency anemia in adults and children aged 14 and above. It plays a crucial role in replenishing iron stores in the body, thereby aiding in the production of hemoglobin and improving overall blood health. Iron deficiency can lead to significant health issues, and this treatment is essential for individuals suffering from conditions that cause low iron levels. How it works. The injection releases iron from its complex form, which assists in the synthesis of hemoglobin and enhances the red blood cell count, effectively managing iron deficiency. Directions for use. Richar Cr Injection is administered intravenously by a healthcare professional. The physician will determine the appropriate dosage and duration based on individual factors such as age, body weight, and the severity of the anemia. Patients should not attempt to self-administer this injection, and it should only be given in a clinical setting to ensure safety and efficacy. Possible side effects. Common side effects include headache, dizziness, flushing, high blood pressure, and nausea. In rare instances, more serious reactions may occur, so it is essential to consult a healthcare provider if any side effects worsen. Precautions and warnings. Prior to administration, it is crucial to inform the healthcare provider of any existing health conditions, especially pregnancy, kidney disease, or allergies to iron products. Caution is advised in elderly patients and those with chronic health issues to ensure safe usage. FAQs. 1. What is the use of Richar Cr Injection? It is primarily used to manage iron deficiency anemia. 2. How does it work? It releases iron to help synthesize hemoglobin and increase red blood cell count. 3. Is it safe for kidney patients? It should be used with caution in those with chronic kidney disease. 4. Who should avoid it? Those with iron overload or known allergies to elemental iron should not use it. 5. Can it interact with other medications? Yes, inform your doctor about all medications you are taking. Thank you for watching. If you have any questions or suggestions, please leave a comment below. We appreciate your engagement.